Good morning, Dr. Dave here. Nice to be with you as always. Happy New Year. Happiness is a choice, right? Well, not if you're clinically depressed. And what do we mean by depression? I know you're reading everywhere, right? All over the news feeds, all over social media, that rates of depression have spiked, gone way up, temporarily coinciding with the pandemic and lockdown and everything that has since ensued. What do we mean when we say depression? Well, here's kind of the clinical definition. Keep in mind when we say depression, we mean major depressive episode, usually as part of a major depressive disorder, although it can be bipolar. Look out. Right? Syndromal depression, clinical depression, that's what we're talking about, which is roughly as follows: 2 weeks, just 2 weeks of all day, every day, one of two cardinal core symptoms, and that would be the sad, depressed, down, blue mood, or all day, every day for 2 weeks, lack of joy, anhedonia, the fancy Greek term. It could be both, right? Sad, down, depressed mood, or anhedonia. Now you also have to have 5 of 8 or 9 of the following symptoms: sleep disturbance, either too much or too little sleep, decreased energy, decreased focus and a concentration, feelings of guilt, hopelessness, helplessness, worthlessness, too much appetite, too little appetite, and then either psychomotor retardation, which means you just simply can't get moving. It feels like you're walking through molasses, that leaden paralysis we talk about, or conversely, too much motor activity, psychomotor agitation, where you can't sit still. You're restless almost to the point, again, of being agitated, right? So those symptoms, along with depressed, sad, blue mood, or lack of joy, 2 weeks, all day, every day, and you've got yourself a diagnosis, get help immediately. Also, just as a reminder, depression increases one's risk for suicide, contemplating, planning, actually attempting to take one's own life, obviously a medical emergency. Now, I've already gone over 2 minutes. I'm going to have to get back with you on, well, how do we make the diagnosis? What's the big dope deal about depression? Pretty significant. And then different treatment approaches. All right, until then, I'm going to go see some patients, stamp out wellness or illness, and be back with you soon. Until then, peace out.